I'm Dr. Ritza, and this is Corrective Exercises. Whenever our new practice members start with the Corrective Care program, the portion of care in which we start to correct core problems with the spine and nervous system, our corrective exercises are the homework that's going to allow to accelerate this process by retraining the body, spine, and nervous system to move in a correct way. There are 7 parts of our corrective exercises, and they are the chin tuck, the abdominal brace, the abdominal hollow, the lift and chop, the deadlift or hip hinge, the squat, and the 2-hand rule. When we master these 7 corrective exercises, we can move on to our corrective core exercises and corrective core movement patterns, which will allow us to start rebuilding and to form new patterns of motion for the spine and the body. The corrective exercises are like learning to walk before we can run and sprint, are an integral part of any corrective care program. These corrective exercises are meant to be practiced every day and as much as you possibly can until you feel like you've fully mastered them. They are going to be used with almost everything that you do in life, whether it's getting up from a chair, doing work at the gym, practicing your favorite sports or recreational activities on the weekend, or working through our corrective exercises and rehab programs later on. I hope you enjoy. Our corrective exercises start off with practicing our chin tuck. That again, we're going to do 10-second holds, shooting for 30 10-second holds throughout our day. Our chin tuck again, finger on the chin, keeping the eyes parallel to the ground, straight back, hold for 10 seconds. The next part of our corrective exercise is, of course, the abdominal brace. The abdominal brace is equivalent to the chin tuck, but for the thoracic, lumbar, and pelvic spine. And so with the abdominal brace, it's like putting a corset on around the spine to keep it nice and stiff and stacked and protected. And to practice the abdominal brace, you can think of either 2 things. What the muscles would feel like when you're going to get punched and you tighten everything up, or if somebody was going to tickle you and you notice that it becomes tight all around the core. When we're first practicing the abdominal brace, it's best to do it lying down and then seated and then standing up. And the abdominal brace you can practice either with or right after the chin tuck, and our goal with the brace is to do 30 10-second holds. With the abdominal brace, be sure to be breathing in and out through your belly button throughout it. The next corrective exercise that we must master is the abdominal hollow. The abdominal hollow is different from the brace in that it's not forming that protective shield around the spine, but activating the transverse abdominis muscle that sucks our gut in. And to practice the abdominal hollow, you're going to try and draw your belly button straight back and through your spine, like that. And you can notice here that it forms a big hollow underneath the rib cage, and I can still speak and breathe pretty easily while I'm holding that hollow. Now, because the hollow is just focusing on that one transverse abdominis muscle, we're going to focus on this one a little bit less and do 15 10-second holds throughout the day. The next part of our corrective exercises is the hip hinge. Now, the hip hinge is incredibly important because it's going to dissociate or separate movement between the hip joint and the spine. A lot of people, when they're coming through the corrective care program, are not able to distinguish the two and end up bending too much through the low back, which is meant to be stable and not mobile like the hips. So to practice our hip hinge and eventually our deadlift, we need a dowel, hockey stick, or a golf club, anything that's straight. And we're going to put this on our spine so that we have 3 points of contact between our head, our mid-back, and our pelvis. And what we're going to practice is keeping all 3 in the same place and touching, and sending our hips backwards as we hinge backwards. You'll notice that you've gone too far, done it improperly, if you lose contact with anywhere in the dowel. A couple things that can help people as they're going through the hip hinge is standing close to a wall and trying to touch it with your buttock, or pretending like you're drawing your hands away from somebody karate chopping you in the hips, or like somebody's pulling you on your belt backwards while the core is braced and stiff. The next part of our corrective exercises is the squat. Now, the squat is one of the most important movements that we need to master as part of our corrective exercises because it allows us to do a lot of rehab exercises and again dissociates between movement in the spine and movement in the hips. And so for proper squat, there's a couple things we need to be able to do first. First, we need to be able to master the screw out mechanism again. So the screw out mechanism is where we have our feet pointing a little outwards, and we need to add some torque into them. So we're going to push into the ground, but our feet are not actually going to move. So it's going to be like you're trying to screw the feet into the ground and trying to take the floor with you. So we practice our screw out, and then with our squat, hands on our chest, and we want to load up the buttock and the hips as much as possible by sending it backwards and keeping everything in line where our head is right between our knees and our knees are staying over top of our ankles. If I was to load up the knees too much, you'd see I'd come forward, whereas when I'm squatting properly, I come straight back and my back stays nice and tall and the head is looking out a few feet in front of our squat. The other part of our corrective exercises that we need to master is the two-hand rule. And this is where you might want to consult the separate video on the two-hand rule, but this is again where we have our hand on our xiphoid process just at the bottom of our breastbone, our other hand perpendicular to our pubic bone, and by screwing out our feet and setting our pelvis, bracing our core, tucking our chin, I set my perfect posture by having the two hands parallel to the ground and showing that my neck, mid-back, spine, lumbar spine and pelvis are all stacked on top of each other. Our final corrective exercise is the lift and chop. And there are two lift and chops that we need to master. First, one on our knees and then one in a lunge position. To perform a proper lift and chop on our knees, we have our chin tucked, our core braced nice and tight with our spine stacked on top of each other, and whether either with a dowel or resistance band, we're going to work on bringing our arms up and then down like we're lifting up and then chopping a piece of wood. And you'll notice that as I do this, the only thing that moves are my shoulders and not my spine. And then from this side, up and down. Lift and chop. The next progression for the lift and chop is a nice lunge position where our glutes tightened. We have our spine stacked on top of each other by a braced core, chin tucked, 90 degrees at the knee, 90 degrees at the knee and the hip. And with this one, we lift and we chop. We lift and we chop. We lift and we chop. And so this is the final part of our corrective exercises. And with the lift and chop, in an ideal world, we want to practice doing 30 lifts and chops each day, starting on the knees, and when you feel more stable, moving up towards our lunge position. Those are our 7 corrective care exercises that we first need to master to make sure that we can restore the proper pattern for the spine and nervous system during our corrective care plan. As a reminder, we're going to be doing our chin tuck for 10 seconds, 30 holds in a day. We're going to be doing our brace for the same, 10 seconds, 30 holds in the day. The abdominal hollow, 10 seconds, ideally 15 holds in the day. When it comes to our hip hinge and deadlift, we're going to practice that working towards doing it 20 to 30 times in a day. And the same thing with the squat. With the two-hand rule, you can practice this every single time before you're either going to do a squat or a deadlift, or we're going to do our brace, just so that we can begin to master it and fully understand where a fully stacked posture is. And again, with the lifts and chops, we're going to be doing 30 of those throughout the day. If you have any questions about any of the specific corrective exercises, please ask me or consult some of the individual exercises and the corrective ones that are posted here on the YouTube channel. Thanks, I hope you enjoy.